Hi everyone. I hope you have learned a lot from our case presentation one that based on the numerical data to classify the, the sex of the brain. So in the case presentation two, I will give you a data uh, of a series of the dermatology images that I hope you can develop a deep learning model to differentiate benign nevus and the melanoma. So this is very exciting because dermatology is also a medicine of images, and or you can say that a medical field with patterns. So usually the dermatologist will in their training, they will just see lots of patients and lots of different dermatological problems. So they usually can look at the site of lesion and they can determine what's the pathology of that dermatological skin problems. Okay, so in this data, I will give you about 2,000 dermatology images, which contains 1,000 benign nevus and 1,000 images with melanoma. So here you can see in the left one show you the benign nevus, which is very normal but has a highly variant in shape and colors. And also in the right side, you will see a typical case of melanoma. And usually the textbook will say that the nevus usually have a very regular shape and more homogeneous color. And in the case of melanoma, is usually the border is irregular, and the color is sometimes very heterogeneous. So I think that is for qualitative purpose that you can identify melanoma very easily, but it's very challenging for the computer to develop an algorithm that can differentiate these two things. And the data I provided in this case presentation too is from a public open database, which is called the HEM 10,000 dataset. And this database is a collection of multi-source dermatoscopic images of common pigmented skin lesions. So there are actually several types of pigmented skin lesions, and one of the common skin lesions, pigmented skin lesion, is a benign nevus. And in some cases, if these pigmented skin lesions, for example, melanoma, which is kind of a cancer that you can, the melanocyte will grow without restrictions, then you will become a problem because you will just, like cancer, you will just grow beyond this normal site of the locations and maybe can be metastatic to the other part of the body, then you will become a very serious problem. So it's a cancer. And in contrast to the benign nevus, it requires an early detection, and so it will have quite of a high rate of 5-year survival. So it's very important to diagnose melanoma in the early time, so we can remove the melanoma before it invaded to the other part of the body. So in this database, the provider of this image database, they did lots of the very good work to validate these images. So usually these dermatoscopic images came from different hospitals and different sources, and they were taken in different conditions. For example, different environmental light, or maybe different resolutions. So the providers of this database, they actually did a very good job to not the first thing that they will verify the diagnosis by at least 2 dermatologists, and they also review each images to ensure the quality of the image for the machine learning. So they have done a very good job at the image format standardization. So that's why we can use this database to develop a kind of good deep learning model. So I just want to give you a little background about the nevus versus melanoma. So both are pigmented skin lesions, and in the case of nevus, melanocytes are just benign neoplasms and appear in a myriad of the variants, meaning that it has a very high rate of variation in the shape and colors. But in contrast to melanoma, they are usually symmetric with regard to the distribution of color and structure. So that's why I said in the first slide that usually the nevus, the border of nevus is regular, and the color is more homogeneous comparing to the melanoma. And the melanoma is a malignant neoplasm derived from the melanocytes that may appear in different variants. And the most important thing is that if we can detect melanoma in the early stage, then it can be cured by just simple surgical excision. But if we just let it grow, it may be very invasive, and eventually will be metastatic. So that is the reason we want to develop a deep learning model. So maybe everyone can have an app that can just take a picture of these skin lesions to diagnosing whether the image could be the melanoma. And if you look up into the internet, there have been some applications that claim for this purpose. But I just want you to practice on this database, and so you can have quite a good idea that how this deep learning algorithm is being developed and validated. Okay, so usually the melanoma is related to the sun exposure. So this is the figure from the Wikipedia. Then if you look at different parts of the body, and the risk of having melanoma is different across our body. Usually it will be higher rate in the male is higher risk of the melanoma in the upper trunk of the body, but in the female is usually the higher risk in the lower leg. So maybe just related to the different dressing between the male and female. So this is just a progression of melanoma. So you can see that if we can detect this in the early stage, then we can just use the simple excision surgery to remove the lesion. However, if we just grow beyond the basal cells, grows into the dermis, and even a fat layer, then it has a high chance it will the melanocyte will just goes into the bloodstream and to metastasis to the other part of the body. So that is a problem. And it is a very clear data showing that if we can remove the melanoma when it is in a localized form, then survival rate is very high. It's up to 98.4%. But if it becomes a more regional and even distant form, then the survival rate will drops very significantly. So that is the profile of melanoma you should know. So in this case presentation 2, your task is to deliver a deep learning model to differentiating melanoma from benign nevus. And I have already compiled a data set which contains 1,000 nevus and 1,000 melanoma, so you have a very balanced data set. In the original 10,000 data set, you will find that if you download from the internet, you will find that this database contains a series of color images, but has a different number of cases in each diagnosis. So I specifically compiled a training data set for you, and it contains on just balance 1,000 versus 1,000. And also I just convert the colored images to gray and white images. So just simplify your task. So you don't have to deal with the color images. You just have to look at the gray and white images, black and white images, so you can focus more on detecting the different geometry or shape in diagnosing melanoma versus nevus. And I also will give you an additional testing data set, and this testing data set is will be released a week before the case presentation 2, and I want you to use your model to evaluate this testing data set, and you will give a presentation on the June 18 class. So I think you have roughly just 1 month of time to prepare for the presentation, and I will starting the course of the deep learning, including convolutional neural network, in the next week. So I hope you enjoy this case presentation too, and no worries. I think the purpose of this class is to get into more insight about the smart healthcare, and also you can work on the real data to have more insight about the real medical problems. Okay, so if you have any question, just email my teaching assistant Yiru, and so we will try our best to help you in the case presentation too. Okay, thank you very much.